So ice or heat, what do we use? If you've typically had an acute injury, as in the last 24 hours, you'll find the area will be swollen, will be red, will be hot. And that's typically the time we're going to use ice. Does it have any long-term effect on the injury itself? The answer is no. So at a clinical level, is ice applied to the top layer of skin doesn't actually penetrate deep enough to actually have any change on the tissue or joint itself. But what it does do is it actually helps make you feel a bit better because it numbs the area and tells your brain the pain is lessening here. So from that aspect, it's good. Does it stop swelling and does it actually help the joint itself? No. Why should we use heat? Well, if we've just had an acute injury, the area is typically inflamed, it's red, it's hot. Putting more heat on it will actually just make it feel worse. But if the injury is days or weeks old, what happens is that we get some pain in the joint and we get a lack of movement. So what ends up happening is that pain is subsided when we actually put a little bit of heat on it. And what the heat does actually, it just comforts us and makes us feel better and it allows us to move a little bit more. What it doesn't do is it doesn't actually change the tissue beneath. In other words, it doesn't change the muscle or muscle elasticity and it doesn't change the joint or the joint elasticity. So what ends up happening is we can move a little bit freer because we just feel a little bit better. Ideally what you want to do is, whether it be an acute injury or a chronic injury, is to get that area moving again. So if it's an acute injury, within a couple of days we make sure we're working through getting that joint, whether it be an ankle, a knee, a shoulder, a hip, an elbow, we make sure we're moving that joint as freely as we can within a very short period of time and we get some resistance through it again. The same if it's a chronic injury, we want to make sure that we're getting as much movement as we can into that joint or into those muscles. The heat or ice are just superficial and actually just help us at a mental level.